tracheostomy is a surgical opening of the windpipe or an airway, and that is only done during an emergency procedure. Okay, so those patients, they are having difficulty of breathing. They could not breathe from the nose and from the mouth. So any doctor or any paramedics, they will cut open the throat and insert the tracheostomy tube to provide patient with enough oxygenation, to provide patient good breathing, and to keep the patient comfortable. Okay? So we have tracheostomy. So now, why we are going to, as I said, why we are going to do this, it's because we want to provide good and proper breathing, good and proper oxygenation, and to provide a patient with comfortable condition. So why? So what are the medical equipment that we are going to prepare for a patient if we are going to do our tracheostomy care? So first thing, we will be having our tracheostomy pack. Tracheostomy pack is sterile. So once you open, it should not be with expired. It should be within the expiry. So you should check whether this one is not expired. So there is nothing like anything here that is like broken, tear. If there is something like that, you need to return this to the Central Supply Department or to the Material Supply Department. Okay? So once we open this, we open it on top. Okay? Always all sterile packs, we will open it on top here. You do not open it on anywhere. Okay? So we will be using saline and our betadine solution. So how do we do it? This is the procedure. So we will open our pack, take it from the upper part. So you open it like this, take it out from the pack, set it aside. Okay? And all this sterile pack, thank you, there is here, like a tip, like a tongue. Okay? So first thing, we will put our underpad. So anywhere that you perform your procedure, we will put our underpad. So this is not for anything else. It is for you to keep you safe from, changing the bed sheet. Okay? So we have our underpad. Now we will open. So as we said, all of the universal protocol. We have the universal protocol, right? Everybody knows it.
Yes.
Okay, good. So we will keep it, our equipment, not on the bed, but on a bedside table or our Mayo table. So opening it, we will touch on the tip. So not to compromise, we are not going to touch the tip next. So we will just hold from outside. Outside in the middle. So if our tracheostomy pack, the gloves is not facing you, so just keep it like this way. Hold it and fix it on your proper way. So now, we have the first, we have the glove. Gloves, this is all sterile film. You have to lift it up. Lift in the middle or inside so that we will not compromise anything. Palm up, insert, okay? So fix it from under and you put it up to your wrist. Now second glove, scoop it. Scoop. Palm up, insert. Okay? So fix it now from outside because both of these are already sterile. Next we have a yellow medical plastic bag. So there is an adhesive. Either that adhesive, take it off and fix it at the side of the footbed or keep it aside for a while. Next we have our Vigos. Vigos, keep it aside. Some other gauze, sterile gauze. We have our brushes, our swab sticks. Okay. So we have our string. This is a tie or the string. So patient, before you take care or clean the tracheostomy, we have already this. To prevent this tracheo from falling. Or it is like this, okay? So you have to fix it. So once we clean the patient tracheo, we have it already there. So what we need to do? We need to tie this, remove first the other one, and we will tie the second one, the new one. So set it aside. Now, I will take my saline solution. Putting or pouring the saline solution, I should not pour with this. So I put it a little bit high. Distance will be there. So set it aside. I will get my betadine solution, same way. So if I already touched this and my head is unsterile, so I need to take it out and hand hygiene, make another new, and start my dressing or tracheostomy care. First thing, there is no... Okay, so tracheo, there is nothing there, the tracheo and the thing. To me, is like a round, you know, there is a hole. So as I said, we are doing it only during emergency procedure. Like patient cannot be able to breathe from the nose and from the mouth, so this tracheostomy tube is being inserted. So let's say there is a tracheostomy, assuming it is there. So we will start our care with our brush. So dip it, soak it with betadine. So hold the tube, insert, circular, out, receptacle. Second, same, betadine, go inside the tracheo, in, circular, out, receptacle. Another thing, dip with betadine, so hold it, circular, and to the receptacle. Now we will use our swab stick. Swab stick, dip it with saline. So same way, you have to insert circular, out, receptacle. Saline, so in, circular, out, receptacle. So now patient is clean. If the patient is not clean yet, you can just ask for swab stick. Okay? If you want the brush, this brush will be you can take that brush in a tracheostomy pack. There is no separate. But for this swab stick, you have it separate. So dry, insert, circular, out, receptacle. Dry, insert, circular, out, receptacle. Now, we will use our dry gauze. Fold into 4. Dip it with betadine. So, from the side, okay? Out, in, out, in, out, other side, in, out, or we will just circling one time, out, receptacle. The same thing, we will get our another gauze, saline. So in, out, or you need to go into circular, out, receptacle. So if it is already clean, we will use our clean gauze, dry gauze, the same. Out, in, receptacle, in, in, out, and circular, out, receptacle. So the patient is clean and dry now. So we will apply our V-gauze. The V-gauze, it helps to prevent the leakage. Okay? Not always the patient will be wet. So if ever this is always wet, what you need to do is take your gauze and cut it in the middle, okay? And then you just apply it to the patient under the trachea, okay? Last one, we will be having our string or our tie. So what we need to do, keep it here under the patient's neck. So this one, it depends whether you have to keep it as in enough, not to be loose or not too tight. Okay? It holds our trachea. So one at a time, take it out, the old one. Take that out, replace with the new, tie 3 knots, and cut the excess. Okay? It should come out like this only. The same way on the other side, so remove the old, put the new one, tie 3 knots, and cut the excess. Okay? You should know whether it is very tight or very loose to the patient. So this one, it's already been placed. So as we see our patient, the patient now is full of secretion. Like you will see, you will observe, patient will be like something like that. Okay? So as I said, be careful you do not take off same tie together. Because otherwise you take it off and this tracheostomy will go up to that, over the bed, down on the ground. So what you need to do, take that tracheostomy, saline, wash it with saline, and put it back. There is a hole. Okay? So what you need, otherwise your patient, you will lose your patient. The patient is only breathing by the trachea. Okay? Patient is not breathing by the nose and the mouth. So now, we have seen the patient, we observe patient is not, too much of these secretions now. So what we need to do, I will not remove yet my gloves. I will take the saline. Okay, keep it there. We have the wall-mounted oxygen, wall-mounted suction. So what we need to do is, our suction, we will be requiring wall-mounted suction tubes, wall-mounted suction machine, two of the connecting tubes. Okay, so we will be having two connecting tubes. We will be having also a canister or a suction canister. So suction canister either it has a plastic cover or it has what? No plastic cover. If there is a plastic cover, what you need is that take it off and dispose it to the medical waste bin. But if it is no plastic, so the whole thing, dispose it, throw it to the toilet bowl, and clean it, wash it, return them back. Okay? So what we need now, I will attach to the suction, wall-mounted suction. Okay? So as I said, the canister, the bottle, the canister or the bottle, it has like two wide portal. One from the wall mounted to your canister. Okay? Second tube from the canister to our suction catheter. Suction catheter, we have like this different suction catheters. See this one? So a suction catheter has two holes. One to connect to the connecting tube. Okay? So the other opening or the hole should be for the pressure. That we will do it like this. Okay? So the suction catheter, we have different variety of colors and different also for, like there is a hole here that you can cover. This one without it, so you have, okay, so like this. And we have another one, so the same way, there is also a cover. So all of these suction catheters, it comes with a pack. Okay? So now with the pack, so we will start. Suction means to suck out, to remove, to cleanse the secretion. Okay? So why we will do it is to provide patient breathing, to remove the secretions, and to give patient clear breathing also, to keep the patient comfortable. So what we need to do, we have a saline. So hold it, wrap it in your hand, make sure that the other hole is with your thumb. Okay? What we need to do, we will try to test first whether it's working or no. Set it to 1, 5, 10, 15. So set it to 1. Okay? What we need to check, dip it to the saline and start to suck. Suck out, suck out, suck out. It will be 5 to 10 seconds. Okay? Now it's working. Our suction, the saline went through our canister. So means it is working. We will start now the suctioning to the trachea. Insert, start to suck. Put your thumb here. Do not insert and the same time you are putting your thumb. It should be insert first and suck, 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 suck. Okay? So once it is done, dip with your saline, clean it, suck, 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 out to the trachea, suck, 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 out to the saline, suck, 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 out to the mouth. If there is any secretion from the mouth, suck, suck, suck to the saline, suck, suck, suck to the nose. Okay, so we call this as nasopharyngeal up to the pharynx. So we will insert at least 6 to 8 inches. Together with this, the mouth is oropharynx. So the tracheo is tracheal pharynx also. Okay? So all of this the same. So suck, suck, suck. So to the mouth, suck, suck, suck. Clean it, suck, suck, suck. And patient is okay now. So I feel like the patient is okay. So, but without the secretion, now the patient has difficulty of breathing. Because you made him as in, you did the procedure of sucking and sucking. So the patient now is feeling like dyspnea or feeling like hypoxic. I can see that the patient is becoming bluish. So he needs an oxygen administration. So what I do for this one now, so put it back to your, where is the, okay? So you put this back to the pack. So you have to keep it in the pack like this. You get your plaster and tie it around. If you are still on duty, keep it on your bedside drawer, that drawer on the bedside. Together with your saline, because I'm still on duty, keep it to the bedside. Okay? Because at any time, I will be suctioning my patient. Okay? So now, I will take off all of this. I will do the oxygen administration. So take it all out. My gloves, pinch. 2 fingers out. And keep it all in the yellow plastic bag. Okay? So with the adhesive tape, you put the adhesive tape or you have that wire and then dispose it to the medical waste bin. Now, I will start this one. As I said, if there is still much of this, put it on a bedside table. If not, dispose it. Now, we will do administration of oxygen or oxygen therapy. Okay? So what we need in the oxygen therapy is the built-in oxygen device. This built-in oxygen device is also the same. 1, 5, 10. So it depends on how many pressure. So it will give patient oxygen percent. So what we need to do, so what we have, so for oxygen administration, we have oxygen face mask. Why are we going to do this? Is to provide patient sufficient oxygenation and provide them good breathing. Okay? So we will be having oxygen face mask. So this one has different sizes. There is for the adult, we have for those kids or pediatrics, or we have a little bit bigger. So pediatrics, babies. So if you will find, we have a clip, there is a metal clip. So this metal clip, we need to put it, attach it to our nasal. Okay? So that to prevent it from, what is this? Extending to the eyes. Okay? So what we need to do now, we have also this for our trachea. So what we need to do, connect Set to 1, check it. Check on your face, on your chin, okay, if there is any air coming out, or check it on your skin. Okay, so only then, if you find there is an air coming out, so we will put it to our patient. So putting this, if there is no like this, to put in our trachea, either we can use it over the chin, down under the trachea. Okay? It doesn't matter, it will leak because it's open both in the other side. Or, we have the tracheostomy. Okay? So you will put it the same on the chin, under the trach, and for oxygen. Okay, so we will attach this with connecting to the oxygen. Otherwise, we will put this, if the doctor without the trachea, the doctor will ask you, okay, so just put an oxygen face mask. So over the chin, here, the metal, it should hold your nasal bone. So that preventing it to spread to your eyes. Okay? So other than this, you can use the nasal prong. This is the nasal prong. Okay? So nasal prong, we cannot use this for the trachea. So we will put it only for those patients that requires with the nasal. So a little bit up to the patient, put it above the ear, and you have to fix it, adjust it under the head or under the nape. Okay? So if in case this is rolling, so you need to put a plaster here, okay, so to prevent it from rolling. Okay, so once you have seen your patient is okay now, you feel like the patient is not bluish, so what you need to do not just remove this. Take your pulse oximeter and check whether your oxygenation, your patient oxygenation is okay. What is our normal in the oxygen saturation? 95 to 100. Okay? So if it is already 99, so you can remove it and inform or document that your patient is okay now. Inform your nurse that the patient oxygen saturation is already 99. Okay, you cannot just remove it by removing. You need to know your patient is stable with oxygen saturation of at least 95 and above. Okay, so this is our oxygen administration. Then put it off and document. Any question? Any question? Huh?
Now, if you're not on duty, because you said if you're on duty, you have things like sitting at the bedside table. But if you're not on duty,
Throw it all away.
Trash it.
That's all. Do not keep it, because the next nursing assistant or the next caregiver or whatever will just say something. Why? It's dirty, it's dirty, it's dirty. So you better take it away so that there is no question. Okay? Any more questions? patient require, so you do the suctioning. If the patient doesn't require anymore, it's your decision whether you need to suction more or not. Okay, so it depends upon you. Do you think you will stop? You feel like your patient has more? So it depends upon you.
Solution. Suctioning.
Suctioning, connecting tube.
This one.
We need
Nasal
two.
probe. Probe, right? Nasal.
Nasal probe, P-R-O-N-G,
P-R-O-N-G.
or nasal catheter.
Catheter. Nasal catheter.
Yes, sir.
We are in the final, right? In the practical, you ask me, I will answer you. But in the final assessment, so you better know it. So clear, right?